Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people that you do business with. And today we're very excited to have Dr. Jeffrey Miller. He's a vein specialist at Miller Vein. He opened the clinic way back in 2006, and they have 8 locations now in the Metro Detroit area. And just really interested to talk to him about different conditions that maybe you didn't know you had, but they're all very treatable. So first of all, Dr. Miller, thanks for joining me in your busy time schedule. And how you doing today?
Great, and thanks so much for having me. I appreciate it.
So I know you're a fellow Spartan. We're both kind of wallowing in the end of the season here a little bit, but tell people a little bit about your background, some of your certifications, and what eventually led you to open Miller Vein.
Sure. So by training, I'm an interventional radiologist. Most people don't know what an interventional radiologist is. Basically, it's a physician that specializes in image-guided procedures. So in a sense, the entire field is dedicated to having patients avoid surgery. So we do all kinds of minimally invasive procedures so they can avoid it. And a big part of interventional radiology is in the vascular arena. And back in 1999, a device got FDA approved to treat the underlying cause of varicose veins. So that's when I started in the hospital while I was an interventional radiologist. That's when I started treating vein disease, or at least the superficial vein disease, in other words, the cause of varicose veins. So what I found out in a short period of time is that these elective procedures really don't fit into a hospital. So people would come in for an elective procedure, they really shouldn't have to wait, but then an emergency would come up, and then the poor patient would have to wait an hour or 2 hours or whatever. So over time, I decided, what, I can do it way better. In fact, I was in a very large radiology practice at the time, and I was trying to convince them to invest in a vein clinic, and we could run it, and we could see our other IR patients in the clinic. And after trying for about 5 years, I knew it wasn't going to happen. And with the blessing of my wife, she said, "Why don't you just give your notice and just go do it?" And that's how it started back in September of '06.
So cool. And I love highlighting these outpatient medical facilities. There's so many of them out there now. And you're right, people would rather go to them a lot of times in the hospital if they can. But
yeah, so much easier. I mean, because we really can get a patient in and out of the office. In fact, the procedures we do are typically less than 20 minutes. It's just very convenient.
So back in 2006, when you're planning this business out, I'm sure you had a checklist of things, but I'm guessing preparing for a pandemic was probably not on that checklist, not something you felt like you'd be facing. So tell me how you adjusted to COVID and maybe some changes that you made that will be actually long lasting and helpful for your business.
So it's interesting. When COVID hit, we started talking about it every week. We'd have a meeting to see where are we heading. This is well before the governor did the lockdown. And specifically, I think it was March 22nd was when it was official that elective outpatient medical procedures could no longer be performed. And literally, it was right before then that we had already elected to, we're just going to close. We started getting feedback from our front lines that people were getting a little bit uncomfortable, too much uncertainty. And we could also see that really just the public was afraid. So our new patient volume was decreasing rapidly. And so we fully closed. We had a tiny team operational just in case somebody needed an emergent blood clot study, an ultrasound, so we could make sure that somebody didn't have a blood clot. So potentially, our referring docs, instead of sending their patient to a hospital, which nobody wanted to go to, obviously, we would send our team to whichever site we needed to go to. So we kept that service going. And had a few calls. And basically just week by week by week, we just kept having meetings to see how things were progressing. Everybody in the company really, we kept in touch with everybody. So nobody felt like they had no idea what was going on. When are we even, what's the potential of opening when, et cetera, et cetera. We continued providing our healthcare insurance to all of our employees, and that for pretty much everybody, that was like the biggest relief. And, we just basically weathered the storm until we heard that we could open up again. And then at the very front end, we had a ton of supplies that we knew we weren't going to be using for a while. So we just gave those to fire stations and other medical facilities that were front lines, like PPEs and all the other stuff. So that's more or less how we handled it. And then as soon as we got back up, then it was just a matter of, we followed every single protocol to the nth degree and then some. I mean, we just literally just cleaned out the office, and we've been obsessive compulsive ever since, just keeping everything clean. And I will tell you that there's a sense of normalcy now, other than the fact that we're still germaphobes and wearing masks all the time. But you can sense there's been a difference. You can see now people are coming to the office and they're just not as afraid as on the front end.
And one thing that, and we'll get into what causes some of these problems, but one thing that can lead to it is inactivity. And when you're talking about quarantine for a year, and some people that didn't, there's some people that did exercise more than before, but some people that did not. So I would imagine the need for your services is only going to grow here.
Yeah, absolutely. And keep in mind, really, most medical services, people that have been seeking medical care for anything, they held off. And so, 3 months of people not going to the doctor to get their leg pain taken care of. I think there is a pent-up demand. And as we get further along, especially with the vaccine being out and people starting to get more confidence in going out without such fear, I think we'll get busier and busier and busier. And as it is, we're growing nicely, despite the fact that I think these are still just uncharted waters.
Yeah, we're at the tail end of it, it feels like, but still kind of adjusting as we go. And a lot of the doctors I've talked to have adopted telemedicine and are very interested in that. Is that something you're able to utilize in your field, or still unsure?
You know what it is? The in a sense, it really forced us to set it up so we have all of the abilities to do it and do it well. And we have our patient portal, so it's secure and all that. But admittedly, most of our patients haven't been opting for that. And especially on the medical front, and we could talk about a little bit about how we've kind of got mostly we're a medical practice, but there's a component of what we do that is cosmetic. But on the medical front, people have to end up coming to the office to get an ultrasound as part of their evaluation. So most people don't want to get first a video talk and then schedule another visit to have to come in for their ultrasound. So we consolidate it all into one visit.
Yeah, I think in some cases it can be a great starting point. If someone's crunched on time and they can't get into your office, you can at least take a look and say, yeah, that's something we need to take a further look at, but it's pretty hard to fully diagnose someone over a computer.
Exactly. And, I think where it fits nicely into our practice would be the person who has, they don't have any lower extremity symptoms at all. They feel great. They just have some spider veins. We can do the video consult. We could take a look at their legs and kind of describe how we would treat the spider veins and save an office visit under those circumstances. So we're completely set up for that, but admittedly we haven't been using it much just because so far patients haven't been reaching out to use it.
Right. Good to have as an option,
but it is, and it's nice that we, in a sense, it forced us to really get that thing set up, because I think there is a great deal of value
Well, I can tell you one good positive result of COVID for me personally. I switched from sitting at a desk most of the day to a stand-up desk, as we were discussing before we started recording here. And I used to suffer from one of these conditions we're going to talk about, is this restless leg syndrome, where my Fitbit would be screaming at me, get up and walk around. And, at the end of the day, my legs were so sore and I didn't even realize what was happening till I learned more about it. And getting this stand-up desk and moving around more has kind of taken care of that for me. So we have so many different types of conditions and whatnot that we can cover here, but why don't we start there? I didn't realize 3 million people in the United States suffer from this restless leg syndrome, but it's so easily treatable. So first of all, is this more hereditary or more lifestyle related that you see with restless leg syndrome?
I would lean towards the heredity side. The big thing about restless leg syndrome, it's actually considered a movement disorder, and as you were saying, it's a very common condition. The conditions that we treat, the vein condition, which would be venous reflux disease and the more severe version of it, chronic venous insufficiency. Some technical terms that we can talk about in a moment, but this is a cause of restless leg syndrome. So we frequently see people come to our office. They may not have any visible abnormal veins, so they may not have varicose veins or spider veins, but they certainly have all the classic symptoms of restless legs. And when we do an ultrasound and we find that they do in fact have venous reflux, where blood is going the wrong direction in the vein, we can really significantly impact their lives. So we treat them, and well over 70% of the time, they're going to feel great. So either they're on medications and they can stop taking medications, or their symptoms are all the time and now they're just infrequent. Or sometimes we get that actual cure where it's just completely gone. But the big thing is, I'm a firm believer, and studies do support the concept of, before going on the various medications for restless legs, it's a good idea to get worked up for a vein condition, because that is a treatable form of the whole problem, and the treatment is so easy.
So before we get further into other conditions, what would you say would be good triggers for people listening that they might be having problems with their veins, different things they might be able to see, or different things that they're feeling that should be a trigger to at least call you for a consultation?
Sure. So the common symptoms are pain, swelling, aching, throbbing, heaviness, fatigue of the legs. Most people will tell me that if they have the opportunity to sit down or lie down and elevate their legs, that's going to make their legs feel better. The other thing is most people will tell me that the symptoms get worse as the day goes on. And then, as we already mentioned, restless legs, another symptom of the vein condition. And lastly, if the veins are never treated, things can go on to the more severe condition we call chronic venous insufficiency, which leads to skin changes and potentially a leg ulcer.
So let's talk about leg ulcers a little more. That was a topic that you wanted to cover. What are some signs of that and different treatments that you offer for it?
Yeah, so I mean, a leg ulcer is, in a sense, it's something that a patient would diagnose on their own, or at least look down and say, I've got an open sore, an open wound, whatever you want to call it, and it hurts. They know they have it. So what many people don't know is that at the very least 60 to 80% of lower extremity non-healing wounds are actually caused by veins. So most people are thinking, oh, it's arteries, or it's diabetes, or heart condition, etc. But actually the number one cause is the vein condition that we're treating.
What are some of the other common conditions you see? I mean, spider veins and varicose veins, those are probably the most common terms that everybody hears all the time. What causes those, and what are some treatments you have for those?
So varicose veins are caused by the same condition we were just talking about. In fact, may as well start with, what is venous reflux disease? So normally all of our veins carry blood upward towards the heart. They're returning blood from the legs. And inside our legs, we have these little one-way valves. When our muscles contract, blood is squeezed and pushed upward, the valves automatically open. And normally these valves would snap shut and prevent blood from going the wrong direction. With venous reflux, the vein is weak and the valves no longer oppose one another. So now blood is allowed to go the wrong direction. And if you were to think about a tree, an upside down tree, and that this vein that's allowing blood the wrong direction is the tree trunk, the varicose veins would just be branches coming off that trunk. And so now these branches are getting all this blood that they're not accustomed to getting, and they bulge out, and then we can see them on the skin surface. Similarly, spider veins, the concept is somewhat similar, but frequently that the bigger vein that we're talking about here, it could be a tiny vein, and it doesn't require, and we'll talk a little bit later, it may not require the medical treatments such as ablation. So that's what we see in terms of varicose veins, spider veins. We also see a lot of patients that have lymphedema or lipedema, kind of, in a sense, we just see a lot of people with leg swelling. And venous insufficiency can either be the cause of some of these conditions, or it's superimposed on some of these conditions, and treating the venous reflux is critical to helping people resolve their swelling.
And again, so many of these are very treatable. It's always, the key is catching them early. Generally, for most of these conditions, how long does it take to start to see improvement in your patients?
Oh gosh, I mean, that reminds me of a classic example. I had a young patient who did a lot of manual labor, and he had a non-healing ulcer, and he was actually popping Vicodin around the clock so he could work. He came in, we did this ablation procedure, and he said within a week he stopped taking Vicodin. You could not believe it. Now, did that close the wound immediately? Absolutely not. So the wound was still there. Eventually it closed. But in terms of how he felt, he really did get almost immediate relief. We hear that a lot in our typical patients. So the more typical patient is, we're treating somebody with varicose veins. A lot of people come to us with varicose veins. They didn't even know that, their pain, aching, and throbbing is related. And then we treat the varicose veins, and they're like, wow, so this is what my legs are supposed to feel like. And it happens pretty quick, week, 2 weeks. It's dramatic.
And then is it sort of like taking vitamins where you want to stay on top of it long term? It's not just immediately fixed and you forget about it. Once someone has these conditions, is it something they should continue to monitor really for the rest of their life?
Yeah, and I'm glad you asked that question. That's a great question. And you know what? It is a chronic condition. So we do keep our patients on a follow-up protocol, or at least touch base with them. So we've seen it where 3, 5, 10 years later, the condition's back. Typically, the veins we treated stay treated, but it's not unusual we've got a lot of veins in our legs, and it's not unusual for a different vein to become unhealthy and start causing the exact same symptoms. So yeah, it's a chronic condition and it should be monitored, and then the repeat treatments are easy. In fact, what happens usually after somebody's gone through the whole process, and they're not afraid anymore. So coming back in for a follow-up and getting some more treatment, they're not worried, and they're looking forward to getting their legs back to new.
Absolutely. So Dr. Miller, we've talked about restless leg syndrome. We've talked about leg ulcers. We've talked about spider veins, varicose veins. What are some of the other things that you've seen, or other types of disorders that you'd like to discuss?
I think those are really the biggest. I mean, that is our everyday practice. Yeah, there are some rare things that present to us, but I would say we basically manage varicose veins, spider veins, where everybody that all the physicians at Miller Vein are really vascular specialists. So somebody comes in and they're uncertain whether they have an arterial problem or a vein problem, something to do with the vascular system. We can get the diagnosis, and if it's something we treat it. And if it's something we don't treat, we're going to make sure that the patient gets the care that they need from the appropriate physician.
So tell me a little bit about Miller Vein and working there. It sounds like quite a great atmosphere that you create, and the patients can feel that as well. Talk about the importance of how the employees interact with each other first, and then project that onto the patients, and how important that is to have that feeling when your patients enter your practice.
So, it may sound, I don't know, cliche or idealistic, but we really are a company based on values. We hire on values, we fire based on values. And I think the thing I'm most proud of with Miller Vein is our company culture. And, basically our philosophy is that if every single employee, every single teammate loves what they do, that they're going to provide far better care. And at the same time, we only hire the absolute best physicians. I mean, they're almost overtrained for what we do. I mean, we just get the best of the best of the best. And I know I'm bragging a little bit, I apologize.
That's all right.
But our docs are the best, and actually, because of our reputation, most of our patients come from either referring physicians who trust us, or from patients who came to us and they tell all their friends and family. So we don't spend a ton of money on marketing. It's mostly referral based. And the other thing, part of that whole people trusting us, and also because our size, and because we do nothing but veins and we do a lot of veins, when new technology comes out, we typically get first dibs. A medical device company is not going to want to introduce a technology that they've already proven works well and give it to somebody that may not do these types of treatments regularly, because they want to make sure that they get good outcomes and can continue selling their own products. So getting back to the culture, everybody that comes to work, for the most part, I would say they love what they do. We don't have any clock punchers. Our teams, they hang out after work together, and well, during COVID they didn't, but now they're back to going out and in small gatherings. What we did pre-COVID that was actually a great thing for the company, we would shut all of the offices down once a quarter for the afternoon and have what we called an energizing session, where we would discuss medical topics. We would discuss how the business is going. We would break up into little small groups and let everybody brainstorm so that we could get all of the ideas from the front lines. It was almost more of a celebration. It's hard to explain, but we had a lot of fun. We would share success stories. We would announce people made it to their 90-day and make it a little celebration there. It's just really 2-3 hours of fun. We've gone virtual on that, and instead of having the 60-some employees all on one screen, we break it down into each clinic and still have our little quarterly gathering, but we can't obviously do all the fun stuff that we do. We would always have a blast at our holiday parties, and we've done some cool things like go-kart racing and square dancing and just a variety of fun, different things. So it's really a company where we just all have fun working together. We work hard. We have the pace I would describe as fast pace, but people just love it.
Reminds me so much of athletic teams, right? You hear this term, it almost feels like it's overused, with the culture of the team and the camaraderie of the team. And you can see it, like when you watch athletic teams play, you can see which ones get along and enjoy being together and which ones don't. And just like patients can probably see that, like you can tell when you walk into an office, that person doesn't look like they want to be here. So it's so important to project that. So
Yeah, and that was one of the things when I first started Miller Vane that I was just like, I've been to doctors' offices, and some are nice, but some are, they open the glass door, name,
yep.
sign here, here's your paperwork, and then they're carrying on their conversations,
Right.
and you don't feel at all like anybody's listening. And I really wanted to create a company where we were a medical company where we're the exact opposite, where it's just people come in and the moment they walk in, there's a smile on everybody's face and they feel welcome and they feel heard. And then we just provide the highest level of service and quality medical care possible.
And I always like to close with kind of an uplifting story. So you already kind of shared one success story with a patient. Is there another one that kind of sticks out, a heartwarming story of someone that was really having difficulty that you were able to help out?
So one of our values is humble service. And we had a patient, an obese patient, come to us, and he came into the office with his wife. And just at the first office visit, at the end of the visit, we made our diagnosis. We told them what kind of treatment we could help him, or what kind of treatment we need to provide him to help him heal up his ulcer. Him and his wife broke down in tears. And the reason they broke down in tears is we were the first medical office that gave him any hope, number one. But number two, and perhaps this is more important, they both said, you're the first, everywhere we've gone, people have just blamed us. My husband, he's overweight, and they just blamed him and said, lose some weight, there's nothing I can do for you. And that's not part of our ethos. We just treated him like he's a friend, like he's family. And like I said, they broke down and cried. And so that was one of those, I think that exemplifies the value of humble service. So
I love that, man. And like I always say to people, like I could give a list of patients that you've worked with, and you're not going to remember revenue generated from a single one of those people, but I guarantee you remember a story from each one, which makes it rewarding. So, so you have 8 locations in the market, and as we mentioned, I'm sure your services are going to be high demand this year as you catch up on all those people that couldn't come in last year. How quickly can people get in at one of your clinics, and what is the easiest way to schedule an appointment?
So I'll start with how to schedule an appointment. Either go to our website, millervane.com, and you can actually fill out a form there, and we'll set it up. Or call 248-344-9110, and somebody will take care of you. And in terms of, we're typically able to get people in pretty quick, typically within a couple of weeks. And because we do have all these locations, sometimes if we need to get somebody in real quick, and maybe it's they can drive a little farther and we can get them in. And then in terms of future appointments, we would get them into whatever's closest and most convenient.
Well, good to know. So anybody out there that sees any veins that look questionable or feels pain that doesn't feel normal, please see Dr. Miller. All these conditions are treatable. My Fitbit's buzzing here. It's telling me I got to get moving to avoid this restless leg. So I appreciate you joining me, though, and sharing some great info.
Hey, thanks so much for having me. It was nice chatting with you.
All right. Thank you.